Okay, welcome back to another Friends of Medicine podcast, Behind the Scrubs. I'm your host, Dr. Andre Coombs. I am a trauma surgeon here in South Florida, and I'm joined here with a very good friend of mine, Dr. Rudy Ibrahim, and we are here to discuss men's health awareness for Men's Health Awareness Month in the month of November. And we have a lot to cover in this episode, and I'm very happy to have him here because he is a biohacker, he's an MD, and I'm going to let him talk a little bit more about himself. I don't want to take his thunder, but lots to learn here today, lots to cover. And before we get into it, I just want to remind everyone to subscribe, like, share this episode, share our podcast with your friends and family. There's a lot to learn. We cover a lot of topics. And if you have the ability to, please donate. We'll rely on your kind donations to keep this going. And, we're just here to help everyone get educated on lots of different topics. So it really goes a long way when you help us out with a little donation. So thank you for joining us, Rudy. So before we get into it, I would like for you to share with our viewers a little bit more about your background, why they call you the Dr. Biohacker, and how you got into men's health and where we should start thinking about men's health in today's day and age.
Definitely. Andre, it's such a pleasure for me to be here. It's funny. We met outside of the country in Colombia where we went to a mutual friend's wedding.
Yeah.
And, I'm from Haiti originally, from Trinidad. My wife is Jamaican. You learn and train in Jamaica. So we had a lot in common. And I recently became a member of the amazing organization, Friends of Medicine. I'm so excited and to be a part of this because I really love what you're doing. And I really wanted to do this podcast today because November is Men's Health Awareness Month. And men don't talk about their health. Men, when it comes to health, it's a subject we don't talk enough about. And I'm going to tell you my journey, how I went from internal medicine into now practicing men's health, evidence-based men's health. So originally from Haiti, I did actually my first year of medical school in Haiti. Then I moved here in 1991 at the age of 21. My first job was at Dunkin' Donuts. Nice. I had to go and pay to get my studies. Then I went to University of Florida where I got a bachelor's in nutrition. It's like I knew that I wanted to go into that field. Then I went to University of Miami where I got my MD, became board certified in internal medicine in 2001, and did about 12 years of hospitalist medicine in multiple hospitals in the Baptist region, including Kendall Regional Hospital, Baptist Hospital, South Miami Hospital. This was exciting work. I loved it. I worked in the ICU, the ER, my shifts, I carried the code beeper. It was great work. And this is what my internal medicine training at Jackson trained me to do, to really save lives and to prevent disease. Conventional medicine, we're really good at this. But as I got along, I started feeling like, is there more to it? I wanted to go more into the preventive side. But again, I learned my bachelor's in nutrition, but conventional medicine is not that good at helping people feel their best. We're good at preventing disease. We're not good at wellness. So I really had to go and relearn a lot of the things I missed in medical school. The usual medical student only gets 6 hours of nutrition during their medical education. And nutrition and what we eat is at the base of wellness. So I had to go and relearn a lot of this. So I became board certified with an organization called AMMG, Age Management Medical Group, where I really learned the importance of nutrition, the importance of hormone optimization. And I've been doing this now for 12 years. I have my clinic called The New You, which is a sponsor for the episode tonight, where I do mostly weight loss and hormone optimization. I have another clinic where we do virtual visits, and I think in 45 states in the US, called Medical Health Institute, where I do a lot of hormone optimization, testosterone replacement, weight loss, basically biohacking. And I have about 2,500 active men on testosterone replacement therapy. I started actually doing hormone replacement therapy for women, but now in our practice, we have a female doctor taking care of our female patients with an all-female staff. And on the men's side, we have an all-male staff because we feel that you relate better when you speak to somebody from your own sex. So when it comes to men's health, it's something I almost had to relearn completely. Because when I went to medical school in 1991 at University of Miami, the main knowledge was that testosterone was bad for you, that testosterone would cause prostate cancer, testosterone would cause heart disease. So it was almost on every board examination that I was taking at this time.
Oh,
so
yeah.
for me, testosterone was a no-no.
Yep.
Right? I'm sure you have
yeah.
that bias.
Yeah.
Right? So I had to really understand first, why are we seeing such an epidemic of low testosterone in our world? People are talking about this more. It's estimated that they did a survey, I think in 2016, and over the past 10 previous years, testosterone prescriptions have almost doubled. And this is prescriptions through pharmacy. That doesn't even count prescription to compounding pharmacies or people using testosterone illicitly. So I had to really understand we have a problem. There is an epidemic of low testosterone that men who suffer from this did not know where to turn. And the symptoms of low testosterone or hypogonadism, which is the scientific term, are multiple. Because the bias that we have also is testosterone is only for big muscles and sex. It's so much more than this. Testosterone is the most important male hormone that really determines your vitality, your overall health, your mental health, your sexual health. So much testosterone does so much more than just helping you grow big muscles. I'm all for muscles because you know I like to say that muscle is the currency for longevity, but it does so much more than this.
Yeah. I'm glad you mentioned that because I think there's a taboo about talking about testosterones and hormones, etc., especially with men. And it's considered, weak or fragile if you have low testosterone levels. But I think the value of testosterone when it comes to multi-organ health, cardiovascular system, your endocrine system, etc., is something that's not appreciated right now in society and culture. So I think by shifting that way of looking at testosterone is the key to improving men's health overall. And before we get into testosterone and prostate cancer, etc., you mentioned something about relearning all the things that you learned in med school that have been debunked now.
Yeah.
I've had a lot of people come to me saying I should go to a urologist for some of these issues. And I think now the tide is kind of changing when it comes to men's health and testosterone replacement, hormone replacement, and they're looking for experts that are dealing with hormone replacement. And tell me a little bit more about what a man should be thinking in terms of, he's listening to this podcast right now and he says, okay, I want to go improve my overall health as a man. Where does he start? What questions does he need to ask? And who does he need to go to now?
You can't just give a man testosterone and think that it's going to change their life. You need to be sure that you address nutrition, exercise, you help them fix their sleep. You look at inflammatory biomarkers. You make sure that you decrease their visceral adipose tissue. A urologist usually will prescribe testosterone, but will not address all the other components that I like to call the wellness components. So it's not just one thing. Testosterone is a tool that can really help a man go from point A, where he doesn't feel great, to point B, where he really feels optimized. But testosterone is just one tool. All these other things are really important. So again, I got that board certification because I really needed to understand how to do this the right way. I follow, and I'm a member now of the Andrology Society. And one of the mentors that I've always followed is Dr. Morgenthaler. He's a board certified urologist from Harvard Medical School who started doing testosterone replacement therapy in the 80s. And he's a big figure in that world to really help guide. And really, he brought testosterone replacement therapy in the consciousness of not only individual patients, but doctors. Because again, this is what we call the confirmation bias. Whatever you've learned, you kind of want to keep reading things that confirm what you've learned. Challenging yourself to unlearn and relearn new material is really difficult. And us MDs, we tend to have a problem with this because we always almost tend to suffer from quote unquote God complex, right? If a patient comes to you and tells you, doc, it could be my testosterone, the doctor is going to be like, don't tell me what to do. If you learn that it was bad for you, Dr. Google. I actually like when my patients go on Google, because that's a way to start. So I welcome this because now there's a wealth of information. But then when the patient comes in, I can help them rectify some of their information. So, you always hear that, do your research, but be careful what research you're doing.
Of course.
The internet is fraught with this. So one thing that was interesting for me is I started seeing a lot of patients, younger and younger patients having testosterone. So I started really doing testosterone replacement therapy about 12 to 13 years ago. And now, again, I have more than 2,000 active patients taking testosterone therapy. And when you look at the guidelines, whether they be from American Urological Associations or the American Association of Endocrinology, they are based on the number. So normal testosterone level is between 300 and 1,200. In 2017, they did another study where they take usually about 20 to 30,000 men between the age of 19 and 40, I think, and they take an average, a mean testosterone level. So the new levels, if you go on LabCorp right now, you look at what my testosterone should be, the lower number went down to 264, the higher number to 916. So this is, what does that show us? Overall testosterone levels are declining, and those lab numbers are really an average. It's not a physiological number, because in 2017, upper limit was 1,200. In the 90s, it was even higher than this. So studies are really showing that we're losing testosterone at about, after the age of 30, about 1% a year. And it accelerates as we get older. But what we're seeing now, because we live in such a toxic world, thing we call endocrine disrupting chemical, EDCs, things like microplastics, pesticides like glyphosate, atrazine, makeup, all of those processed things that we put on our skin, the processed foods that we're eating are really wreaking havoc on our endocrine system. I like to show that image. Our endocrine system is such a tightly regulated system in our body, because that's what really, hormones determine who we are and our overall health and vitality. Endocrine disruptors are like taking a handful of sand and throwing it into the perfect mechanism of a watch, right? Imagine you have a watch that's a Swiss timepiece that is so correct. That's our endocrine system. Imagine you drop a few grains of sand in there. What would happen to that watch? It would stop working. That's our endocrine system. So when you think about it, let's think about microplastics. Microplastic, the base of it is estrogen. It's xenoestrogen. It's outside estrogen. So when you expose a man to xenoestrogen, there's a negative feedback loop that decreases your own production of testosterone. Studies have shown that male fetus that are exposed to plastics like phthalates, BPA, have a higher chance of developing what we call testicular dysgenesis syndrome, higher risk of low testosterone, infertility, testicular cancer, metabolic disease. And unfortunately, we're seeing that in our society now, we're seeing so many men suffering from this. So we need to rethink that this is not just a numbers disease. It is a symptom-based disease. And to go, for example, with the American Association of Endocrinology, the way that they guide testosterone replacement, they say, the guidelines say that you have to be below, you have to do 2 measurements of testosterone at 8 in the morning. And if the numbers are below whatever labs you're using, then you can be diagnosed with hypogonadism. Remember, I just told you on LabCorp, the lower number is 264. 264 is horrible. Right. You feel horrible at those numbers. So I have a patient the other day, 35 years old, came to me with all the symptoms of low T. Tired, no energy, lack of motivation, gaining belly fat despite trying to exercise and eating better, losing muscle, decreased libido, erectile problems, depression, anxiety. How many young men do we know are suffering from this?
A lot.
He finally went to his doctor. They checked his testosterone level, which he had to beg his doctor for. They checked his testosterone level. His level was 315. The doctor told him, because your level are above 264, it's not low T.
And he had all the symptoms.
All the symptoms. He kept going to the patient, to the doctor. Eventually, you know what they did to him? They told him, you're depressed. They put him on an SSRI. They put him on Zoloft. What does Zoloft do? It makes you gain weight, causes more erectile problem, more decrease of libido, and then vicious cycle. He came to me. I did a thorough evaluation. When I repeated his labs, it was at 285, his total testosterone. Still not below that 264. I diagnosed him based on his symptoms in the lower level with hypogonadism, low testosterone. So first thing I did, and I do that with all my patients, before I put you on hormones or concurrently, I make sure that I help you fix your nutrition. I call it the basic. You need to master the basics: nutrition, exercise, and sleep. Let's work on those first. Let's help you with this. Then if we do this and you don't see an increase in your testosterone, let's consider testosterone replacement therapy. So this particular patient, after doing all the thorough investigation, I studied him on a great program of testosterone replacement therapy, and he's thriving now. The guy was a lawyer, a high-level lawyer, had his corporate law job. He was able to lose weight. He was able to gain some muscle mass. His marriage with his wife improved because he had low libido. He was hiding from his wife. That cannot be good, right? So, and not only did it help him on the physical and on the sexual side, testosterone actually binds to the serotonin receptor in your brain. So it is one of the best antidepressants, and it helps with motivation. So this guy now found the motivation to go to the gym. He was lifting weights. He was doing all the things he needed to do. And even more importantly, he finally had the energy and the motivation. He quit his corporate law job and he's opened his own law firm. Right. I love to say that case because only in his 30s, those were his prime years, and he was wasting it because of low testosterone. Don't let this happen to you.
I know. Remarkable story, great case report, not to mention the impact it may have had on his mental health. Completely. Which is completely tied into overall health and physical health.
Yeah.
So before we continue on into this episode, I just want to take an opportunity to thank Rudy for sponsoring this episode and to remind everyone that's listening that everything we discuss here today is for educational purposes only. Please consult your physician if you have any specific concerns or interests in anything that is being discussed here. I want to also take a short break right now to hear a few words from our sponsor, and we'll get back into some more men's health talk.
All right.
Hi, I'm Dr. Rudy Eberwein. I'm the founder and CEO of UnoTrust Physicians Weight Loss Program, and we are delighted to be the sponsor for Men's Health Awareness Month, series of episodes for Friends of Medicine Behind the Scrubs podcast. UnoTrust is a functional medicine, health, wellness, and longevity clinic that I've had with my wife, Keisha, for the past 15 years. We focus a lot on helping patients lose weight, adopt better habits, hormone replacement, and overall wellness. I am an expert at using GLP-1 medications, testosterone replacement for both men and women, nutrition, behavior modification, and at the end of the day, I really try to help you be the best version of yourself. We also have a med spa associated with the clinic. We use cutting edge technology with the company called BTL that has amazing services like the M-Sculpt Neo to help decrease belly fat and increase core muscle. We have IPL lasers. We have the M-Face to help with non-surgical facelift. So I'm excited to be part of the group, and I will have an open house very soon to invite every member to come and check out my clinic. Thank you. You can reach my clinic at 305-670-2131. We are on social media at drweightlossmiami.com. Our clinic name is UnoTrust Physicians Wellness Program. Our website is www.drweightlossmiami.com.
All right, welcome back to Behind the Scrubs, a Friends of Medicine podcast, and we're here with Dr. Rudy Eberwein, and we are discussing men's health for Men's Health Awareness Month. And, before we took a break, we spoke a little bit about testosterone and its impact on overall health for men. But I think a lot of men are asking, when do I get my levels checked? I myself need to get my levels checked because I've never done that before. I'm 40 years old now, and I'm wondering, should I check, some of the symptoms that I'm experiencing related to that? And what are some of the side effects of testosterone? Because we were taught, like you said, in medical school, that testosterone has a lot of negative side effects, and it was pretty much shunned as a topic in terms of its benefits. So I think it's now a good time to discuss some of the questions that the average man out there may have regarding testosterone and its safety.
Definitely. So I'm going to start first with the safety. Then we're going to go over what a man should ask for and should they check your levels and what age should they check. So I talk a lot about testosterone. As you said, this is for educational purposes. I cannot be anybody's doctor. Don't take my advice here. If you have any of the symptoms I talked about, go see your doctor, get your levels checked, and follow with your own doctor. So when I started doing testosterone replacement therapy, my bias was that it was bad for you. Actually, if you look at any testosterone medication, it has a black box warning from the FDA that testosterone may increase your risk of cardiovascular disease. Because there was a study that was published in 2012 that showed a slight increase in heart disease, cardiovascular risk factors in patients taking testosterone. It was a very flawed study that was actually retracted by the journal that published it, but the retraction never really made it. So we kind of felt and knew there were smaller studies, non-randomized studies that showed that testosterone was good for you, but we never had a really good trial to say that testosterone is safe. Well, we finally got the answer. There's a study that was called the Traverse trial. That was done.
It's pretty recent, right?
Pretty recent. Yeah. So it was run from 2018 until 2023. And the results were published in August of 2023. So it's pretty recent. They followed about 5,000 plus men. And it was a randomized trial that was FDA mandated. Because when the FDA saw that there was so many prescriptions of testosterone, everybody was saying, are we doing the right thing? Are we harming patients by prescribing testosterone for them? So they followed 5,200 patients on testosterone replacement therapy, and the primary endpoint to see if there was an increase in major adverse cardiovascular events, MACE. And there was no increase in cardiovascular disease or cardiovascular events with testosterone. So that gave me a leg to stand on, to say now I have an FDA mandated study, a really strong trial. I think it was published in the New England Journal of Medicine that was evidence-based science. So what else can we ask for this? So now I can say that I can follow the science. It did not show that there were any elevated risk. And we know that in my clinic, when I do testosterone replacement the right way and we help patients improve their nutrition, increase their lean muscle mass, change their habits, their cardiovascular risk go down because now you change somebody's habits. So that Traverse trial really was important for me. And there's another study that's really important because I was seeing younger and younger men being treated. And there's a study that was done actually at the University of Miami, one of the contributors, Dr. Ranjit Ramasamy, that I had the honor to interview on previous things. And it looked at adolescents and young adult males between the age of 19 and 35, and it showed that there was a 20% incidence of low testosterone in that age group. 19 and 35, imagine this. 20%, so 1 in 5 men of that age also suffered for symptoms of low T, and their symptoms started to turn out a testosterone in the 400 range. So again, numbers don't tell you the whole thing. So those two studies really transformed my practice. The Traverse trial let me know that I wasn't causing any harm by doing testosterone replacement with my patients. And the other study I cited from University of Miami made me realize it's not an age thing. You can have low T, unfortunately, at any age because of our toxic world.
Wow, interesting. Rudy, I'm going to play devil's advocate
Yes,
here,
sir.
okay? So we know that the Traverse trial has shown that there's no toxic or negative impact on cardiovascular health. But some of our viewers may ask, okay, so we know about the association of testosterone and prostate cancer. And when we were on the break, I looked up some numbers. It's interesting that almost 300,000 men will be diagnosed with prostate cancer this year alone. And, you know, it's the second most common cause of cancer among men. So how is the impact of increasing testosterone in men affecting the incidence of prostate cancer now? Was that looked at?
Of course. And, you know, I have a passion for prostate cancer because I have 2 uncles who had prostate cancer. You know, in the Black community and the Caribbean community, that tends to be at higher risk. So I have a family history of prostate cancer.
In the world.
It is. So I have a family history. I am from a higher risk group. And I can proudly say I'm on testosterone replacement therapy. Because I'm going to go really quick over this because we have so much to cover. The link of testosterone causing prostate cancer was established by the pioneer of urology, Dr. Huggins, that showed, I think he looked at only 3 patients that showed that when they give them testosterone, at that time, they didn't even have a PSA test. They had, I think it was something phosphatase, prostate phosphatase enzyme that went up. And based on those 3 patients, that was a very flawed study, the conclusion was made that because they gave those patients testosterone, their levels of enzyme went up, testosterone causes prostate cancer. And he actually received the Nobel Prize for that study. And this is what we all learn in medical school, that testosterone causes that.
Gospel.
Dr. Morgan Tyler, again, urologist from Harvard Medical School, debunked that back in the 80s. And he showed that testosterone replacement does not increase the risk of prostate cancer. Actually, low testosterone increases the risk of aggressive, undifferentiated of prostate cancer, because it's funny, the way he explained it is, we always think that when you do testosterone, you have prostate cancer, it's like putting gas on a fire, right? So you're thinking that, because there is no question that androgen deprivation, if somebody's diagnosed with prostate cancer, they'll give you medication like Lupron to block your testosterone. Because really, if you do have prostate cancer, testosterone can make it go up. So this is something I always follow PSA on my patients. But Dr. Morgan Tyler elegantly describes something called the saturation hypothesis, where testosterone, they'll tell you, up to a level of the mid 200 will influence your prostate. But after those levels, it's almost a curve that goes like this. It goes up to the mid 250s, and after that, it plateaus. So the way he explained it is like, if you have a plant and you give it water, you just need the right amount of water. Even if you put more water, it's not going to make it grow faster.
Right.
It's the same thing with testosterone in the prostate. So after I listened to Dr. Morgan Tyler and the multiple hundreds of studies that were done on testosterone and the risk of prostate cancer, I felt that not only for my patients, this was safe, even for me, that I at a high risk with a strong family history. What I do with my patients, I follow PSA on a regular basis. And if there's any increase, of course, we'd go down the testing, MRI of the prostate, referral to urology. But I'm not worried about the increased risk of prostate cancer with CRT.
Right. I mean, remarkable information. I'm glad you're here with us today. I'm a trauma surgeon, so I don't deal with this, but I have a lot of questions that I'm sure some guys out there listening to this may have also. So at what age do I need to start being concerned about prostate cancer? How are they going to test it? Because we all know that digital rectal exam is not something we're too fond of.
It's not fun.
So, can you educate our male viewers about when they should start thinking about this? What are the tests that are available now? Are they still doing the rectal exams? And, when do you start checking PSA? If you started someone on testosterone replacement in their 20s, for example, when do you start checking this stuff?
Definitely. So first, there was a recent amendment, a recent update of the guideline on testosterone, on prostate cancer screening, and it was based on the American Association of Urology. And they said that the digital rectal exam is no longer mandatory. And this is why a lot of men don't want to get screened for prostate cancer, because they don't want that finger. I have big fingers. When I used to do that exam for my male patient, that wasn't fun. So the updated version shows that you don't actually need the rectal exam. All you need is the PSA. And the update also says that before they used to say to start testing PSA at the age of 40, they changed it. They said it should be an individual discussion between the physician and the patient. For example, with me, who has a family history and I'm from a high-risk group, I've been checking my PSA since the age of 35 because my uncles had prostate cancer in their 50s. So it is an individual decision with your patient. The best test, the easy screening test that most primary care physicians will recommend to their patients, if indicated, is a blood test called the PSA, the prostate-specific antigen, and it should be less than 4. Anything below 4, your risk of prostate cancer is low. So that is an important discussion you need to have to your doctor to decide. The guidelines really recommend that you should start screening at about 50 to 55, and earlier if you're in a high-risk group or if you have a family history. Now, when it comes to patients on active testosterone replacement therapy, I do my blood test usually twice a year on all of my patients. And every time I do a blood test, I always check a PSA. And an increase in PSA doesn't immediately mean that you have prostate cancer. Just having prostatitis and inflammation of your prostate can increase that. Interestingly enough, I tell my patients when they're going to check their PSA not to ejaculate for 24 to 48 hours before, because it can artificially increase your PSA. If you had a long bike ride, sitting on that chair like this,
the mechanical trauma
can increase your PSA. So when you get a PSA, you really have to see how, usually if it's elevated, I'll repeat it. There's new tests now called the 4K score test that you can do. But really where urology is going with prostate cancer screening is to do prostate MRI This is a pretty new development in urology where they see that prostate MRI can really help you stratify the risk if you have an elevated PSA, whether you need to do biopsies or not. And really importantly, Dr. Morgenthaler talks a lot about this. Prostate cancer tends to be a very slow-growing disease. Again, in Caribbean and Black population, it tends to be more aggressive. But in general, there's a lot of patients who, even with a diagnosis of prostate cancer, who decide to do an observation type period. They monitor their prostate cancer, and in a lot of them, the doctor will tell them, you have a very slow-growing, you'll die of something else.
Exactly.
Let's just monitor. So go and get yourself checked. Look at your risk factor, have that discussion with your doctor, and when you get the results, make sure that you have a frank discussion about what your risks are to develop prostate cancer.
Yeah, so to all our male listeners out there, that's one less reason that you can have as an excuse to not go to the doctor. We all know that men tend to shy away from getting their annual checkups and just taking care of their own health. Maybe a macho thing. You know, we're going to talk a little bit about masculinity and some of the phrases that are being used nowadays. But I think, you know, part of the reason that men may be less likely to visit the doctor is because they spend a lot of time worrying about all the things that they need to take care of. They're playing hero for a lot of people and not really focusing on themselves. So we encourage you, men, go to your doctor, get checked, even if it's your first checkup. Just go see where you're at, see what your levels are, and start to monitor your health and start to take more time to look out for your own health.
Definitely. And that's so important to talk about this, because when you think about women are trained to go to gynecologists, right? To get their pap smear, if they want birth control pills in their 20s. So a gynecologist, it's a habit. It's a primary care doctor for the women. Men, they don't need to do this. Men avoid this. You know that saying, if it ain't broken, don't fix it. But that's not the right way of thinking about this. You know, I like to give that example. If there's an emergency on a plane, you need to put the oxygen on you first before you put the oxygen on everybody else. So take care of you. Dr. Jaime Sepulveda said that doing this is taking care of yourself, of your body, is the manly thing to do. Because the better you are, the better you can take care of your family.
Exactly.
Don't just hide because of your fear. Go and get checked.
I love that.
And what I tell my patients, don't just go to the doctor. Before you go to the doctor, it's really important. Do an honest self-inquiry. Actually, I told you I was in a recent Bob Marley concert where all of his sons did the music. And I listened again to the song Exodus. And you know what Bob Marley said? Are you satisfied with the life you're living? Ask yourself that question. So before you go to the doctor, ask yourself, are you satisfied with your physical health, your vitality? Are you satisfied with your body composition? Do you have too much weight, too much visceral fat? Your muscle? Are you satisfied with your mental health? Do you have irritability, aggression, depression, anxiety? No motivation. Are you satisfied with your sexual life? How's your desire, your libido? Some guys will tell me, it can get up so I don't have low T, I'm fine. No. What about if you don't have the desire? You have no motivation. So before you go to the doctor, make a checklist of what you really want to ask your doctor about. And I tell my patients, do a little research and don't take no for an answer. If a doctor tells you that all your symptoms are in your head, this is called medical gaslighting. Before you go down the route of antidepressants, again, I'm not against antidepressants. We're going to talk more about mental health, but make sure that they checked all of your hormone levels. I've seen so many patients with thyroid abnormalities that disguise itself as depression and anxiety. So many people with low testosterone that disguise itself as depression, anxiety, irritability. So do a thorough self-inquiry, then do a thorough lab evaluation, and have a really competent physician or provider look at the results and come up with a personalized plan to really help you optimize from wherever you are to a better place.
Yes. I love that you mentioned that. And also focusing on yourself and developing these habits for yourself not only improves your physical health, your mental health, and your family's well-being, but your kids. I think it starts when you're young, you know?
Completely.
So men's health doesn't start when you become a man. It should start when you're a boy. Having that support system, having that safety to know that you have a father doing the things that he should do for his health.
Completely.
Look at the little girls. They see their moms going to the gynecologist periodically. It becomes a habit.
Yeah.
They're used to seeing that. So they grow up and they take better care of themselves. We don't have that culture in amongst men.
Yeah.
So, a friend of mine told me once, when you teach your son, you teach your son's sons. So the only way we can really improve men's health overall is not starting in this generation only. It will impact the generations to come. And overall, men's health will improve.
Completely, man. That is so profound. But at the end of the day, it starts with you.
Absolutely. You need to be that role model.
You need to be that role model. Yeah.
And set an example for not just your son, but the younger men in your circle.
And you can't just talk the talk. Imagine a dad that's not following any of the things we're talking about and tries to teach his son. Again, I'm not talking about, like can an overweight person, of course, teach his son, of course. But work on your habits, work on yourself, and pass on better habits to the other generation. But first work on you. That's the one power we have, is our own influence on ourselves. Change yourself and everything around you will change.
Yes. So you touched a little bit on cardiovascular health. What should men think before they go to the doctor when it comes to their cardiovascular health? What are some of the questions they should be asking, not just themselves, but their doctor?
Yeah, so cardiovascular disease is the number one killer in the United States and throughout the world. And men to suffer way more cardiovascular disease than women. Again, there's many reasons for this. And we think that, men's behavior, a lot of things contribute to that increase in cardiovascular disease. So when you go see your doctor, number one, you need to know what your blood pressure is. And the guidelines recently changed for blood pressure.
Again?
It's difficult, man. They keep changing. But, although medicine is not an exact science.
True.
The only way we can know what do, you do different studies, you look at things, and then you look at a trend. And what they noticed, that blood pressure between 120 to 129 on the systolic and between 70 to 79 on the diastolic, which we used to consider normal blood pressure. Now they've seen that long-term mild or stage 1 hypertension increases the risk of cardiovascular disease. So hypertension is defined as blood pressure above 140/90. Still that
also
definition.
known as the silent killer.
Silent killer. You have no symptoms. People will tell me, but I don't have a headache. I feel fine. It's a silent killer that will take away the lining of your blood vessels, endothelial dysfunction, and increases your risk of heart disease, stroke, and all of this. So you want to really be sure. Again, I recommend to all my patients, don't just check your blood pressure when you go to the doctor's office, because it can be white coat hypertension. It could be artificially low. Get a good blood pressure check or go to CVS, Walgreens, where they have them. Check it at different times of the day, different moments. And you really want to see your blood pressure below 120/80. Now, if you're in that range between 120 and 128, it's that mild or what they call stage 1 hypertension. Yeah, is medication your first choice? I usually tell people, change your habits.
Lifestyle changes.
Lifestyle changes. If you need to, let's lose some weight. Let's improve what you eat. Eat less processed foods, less sugar, less salt. Let's help you gaining muscle. Muscle helps to protect against hypertension. Do breath work. Did you know that the FDA approved a breath, something that controlled your breath, paced breathing, and it's been shown to decrease when you do it for 20 minutes a day or 10 minutes twice a day, decreases your blood pressure sometimes by 10 points. So if you have just 10 points increase, medication may not be your first go-to. Try all of those things, meditation, yoga, breath work. If you don't believe in this
What I remember with the breath work is Wim Hof breathing.
Yes, I actually did Wim Hof breathing when he came to Miami. And I'm a big believer in cold plunges because it helps you go from the sympathetic overdrive that we all live our life on to a parasympathetic rest and digest. So, and even
Forced regulation.
And it's paced breathing. So you don't need to even do cold plunges. Just slowing down your breath. We tend to breathe 12 to 18 breaths a minute. If you can bring down your breath to 6 breaths a minute, I do guided breath work. Do that for 10 to 20 minutes. It's very relaxing, and you can show, anybody who has high blood pressure, do this. Do a paced breathing exercise for 10 to 20 minutes a day. You'll be surprised to see the changes in your numbers.
I'm going to try that next time I do Wim Hof.
Yes, sir. Yes, sir. And then when it comes down to cardiovascular disease, what do you do, right? So, of course, you have to go and check your cholesterol numbers. But cholesterol now, it's so much more complex issue than what we just thought. That, a high cholesterol above 200 increases your risk of heart disease. You need to go a little deeper. You need to look at your triglycerides, your HDL, not just your LDL, the bad cholesterol. I look at the ratio between triglycerides to HDL, the ratio between cholesterol to HDL. For the patients who are lucky enough that their insurance can cover a fractionation of their lipid profile, you look at the different particles. You look at LP little a, ApoB. All of those things are risk factors for heart disease. I always ask patients also, tell me about your family history. If you have a family history of heart disease, let's say your dad had a heart attack in their 50s, you're at high risk. So you need to be more aggressive in your screening than the person who doesn't have this. If you smoke, if you overweight, if you drink a lot of alcohol, all those are risk factors. So everybody listening, I want you to really, again, do a self-inquiry. Look at your doctor. Try to estimate what they call your 10-year cardiovascular risk. And if you see that risk is elevated, you need to do something about this because cardiovascular disease remains the number one killer in America.
So right now, I think it's a good time to touch on mental health. I'm not a mental health expert. You, in your practice, probably see some patients that you need to refer to psychiatry, have more experience dealing with mental health on a clinical setting than me. But I think some things that come to mind when it comes to men are workload, tough jobs, very long hours and shifts, myself included. Sometimes I do 36-hour shifts. Sometimes twice in a week. Divorce, relationship issues, our sexual health, and the pressure to perform, not just sexually, but what is considered the role of the man in society. And I think a lot of this potentially contributes to this new term, toxic masculinity, where we feel like we have to overcompensate. Definitely. And that in itself can impact negatively on mental health. So there's so much to talk about when it comes to that, but why don't we just touch on a few of these items and give some advice to the men listening in our audience?
And first, I'm going to share something very personal. 7 years ago, my older brother, who was my best friend, they called him my twin, died by suicide. Alcoholism, depression. So sorry to hear that, man. Thank you. But this was a defining moment of my life. And I realized how come me, the MD, and the family didn't realize the pain that he was suffering. So he made it real for me. It made me realize that he suffered in silence. And he didn't reach out. He didn't reach out the way he was supposed to. So I have a lot of heart when I talk about this because this is affecting so many men. Men are more likely to die by suicide than women. Mental health crisis in our young men and men in general is outpacing that of we see for women. And there's multiple reasons for it. Everything that you said, a lot of men cannot find their place in this rapidly changing environment where it's no longer, they call it almost a pink economy, where like the jobs that are available are no longer just the manufacturing jobs, the jobs that are traditionally reserved for men. And men are not even keeping up with degrees. At law school and med schools now, they have a higher female attendance. Actually, in 1991 at 1994 at UM Med School, my year in med school was the first year we had more female than males. And that trend is continuing. So it's a lot of pressure.
Even at the executive level in healthcare. You attend these conferences, I'm sure you've seen
75% female.
Yeah.
It's the C-class executives, 75% female. I have 2 daughters. So for me, I'm all into girl power. But we can't forget our boys. We need strong men to be able to deal with those strong women. So when it talks about mental health, it is so complex. There are so many things to it, right? Social media and the need to compare yourself to others and to always show a face, such a difficult thing. Porn addiction, such a difficult issue. When I was growing up, if I wanted to watch porn, I had to sneak into my dad's cabinet and steal his Playboy catalog. I'm aging myself here, right? Now you have it 24 hours in your hand and you get that dopamine release.
Younger and
younger. And there's so many things that can affect mental health. And men, we tend to, we hear that. Real men don't cry. Real men don't show their emotions. Pick yourself out, be a man. Those are outdated things that we need to get away with.
Yeah.
I still believe that masculinity is needed.
But not the preoccupation to be alpha only.
Exactly.
There must be a balance.
A balance.
Like you mentioned when we were discussing earlier, compassion, empathy.
Yes. So it's funny because I talk a lot about this because I'm an alpha man. I want to be at the top. I played a lot of basketball growing up. I wanted to crush my competitive. You're a competitive athlete. I wanted to crush my competition. I always want to dominate my team. I love to be a great provider for my family. So I like to lead. I'm married to a Jamaican woman. They don't play. And she's also a doctor.
You have to be an alpha.
Yes, man. But you have to be an alpha that allows your partner to shine. What example did we see with our grandparents or parents, especially growing up in the islands? The way a man showed himself, he pushed down the women. He led with aggression.
Force.
He led with force. I want to lead with compassion, with empathy, and I want to lead by example. So I've defined a term that I called a theta male instead of an alpha male.
Okay.
A theta male is a man that has all the good characteristics of an alpha. He wants to lead. He wants to win. He wants to really provide. He has that manly quality. You're going to listen to us. I'm putting manly in parentheses. Masculine power. A lot of women have masculine power. So it's the yin and the yang. But men, I want to be an alpha man, but I don't want the negative connotations that comes with alpha.
Right.
A lot of times alpha men have have a tendency to be overconfident, aggressive. You think they tend to not be the nicest people. Think about Michael Jordan. Michael Jordan is an alpha. He wanted to win at any cost, and his teammates will say that. He wasn't the nicest guy. I want to be a leader. Again, I'm not a people pleaser, but I want to lead by example. I want to have empathy. I want to have compassion. And I can still kick somebody's if I need to. Right? This is what we need. Now imagine a world where men had this. They wanted to still provide. They wanted to still lead, but understanding that they let their partners shine also. And you don't lead by force. You lead by example and with love, with compassion. Those are words that men usually don't have in their vocabulary. Now, I say I love you to so many of my friends because love with a capital L is so important to bring into your life. I hug a lot more. I'm a lot more understanding. I'm a lot more compassionate because I brought that into my traditional, more alpha growing up, and it made me a better person, a better father, a better husband, a better physician, and a better member of my society.
Wow, that's beautiful, man. So theta male, that's
theta male. So instead of an
alpha with more balance, more in tune with compassion, empathy, and leading by example.
Yeah, we need this. And we need to talk about
this. And to be easy on yourself. Don't be so hard on yourself as a man.
Yes.
You have all this societal pressure from your family, pressure from your kids. Everyone wants your time. Sometimes it's okay to just let go and take time for yourself.
Yes.
Go for a run, go to the gym, go on vacation. I went on my first solo vacation last year. Man. And I was terrified.
Yes.
It took me 4 days to just get out of my shell and just be me.
Wow, man. That's
it's
profound.
Okay to just take a break from being that alpha and recognize that you don't have to be everyone's hero 24/7. Sometimes you just need time for yourself so that you can actually be there for others.
Andre, man, it's so important to say about this. And, you share with me how you competitive athlete, like long jump, right? Almost got to the Olympics and you were at the top of your game and then unfortunately you sustained an injury. And how do you bounce back from this? And, when I think about my brother's suicide, that has been my biggest teacher. We talked about this. I love Rumi, the 13th century poet, who said it's through the wound that light enters. My wound was my brother's passing. One of your wounds was your injury that you weren't able to complete. It's not what happens to you. It's what you do with what happens to you, how you bounce back. And the goal of a theta male is to take your pain and bounce back even higher than where you were before.
Yeah. Out of chaos, there's opportunity.
Sun Tzu, the art of war, baby.
Yeah.
So read, Read, put stuff in your mind. Stop watching just the news and all the negative news cycle out there. You know, what I love with the internet is, you know, like if you get the right, you follow the right people and you know, like it feeds you this. So my Instagram now, it's all about the Stoic philosophy, Zen philosophy. I see a lot of dancing, laughing, but all positive things. I try to stay away. For me, I read the news on my apps. I know what's going on with the world, and then I'm done. I don't like the 24-hour news cycle that keep repeating negative and going through all this. You need to know what's happening in the world, but then go and live your life. Go and be a better man. Go and be a better person. Because we're talking about men's health, but that's for everybody listening to this.
Yep.
We can do better. And men, we do need to do better.
It's not about surviving, it's about thriving.
It's thriving. Don't live in scarcity. Live in gratitude. So I have 3 G's. You know, I like my little Dr. Rudyism. I live my life by 3 G's. I live by grace. I express gratitude.
Always.
And I remain grounded.
I love that.
I live in the grace of God. I express gratitude daily. And I remain grounded because I'm human. I'm weak. I'm going to fail sometimes. But because I live by grace, I know I'll be okay.
Pick your
3
daily
G's,
mantra.
baby.
Yeah,
Yes.
I love that. Any closing remarks before we finish off this first episode in a series, by the way, of episodes related to men's health awareness this month of November?
Completely. Any men listening to this, and we're talking to the men specifically for the month of November. First, do a self-inquiry. Like Bob Marley said, are you satisfied with the life you're living? Look at yourself honestly and see where you are and what can be improved. Once you do this, find yourself the right provider. I tell everybody, they need to be their own chief medical officer, their own CMO. You don't just go to the doctor. You see that all the time. When finally got them in to go into their doctor and I'm like, how was it? They told me everything was fine. Do you know what your blood sugar is? The doctor didn't call me because he told me I would call you only if something is wrong. I'm like, you need to know your health. Men know how many horsepowers their cars are, you know, like how to change oil, how to change everything for their car. You ask them anything about their own health, most men don't know anything. So educate yourself, find a partner, a medical provider who really is going to work with you. You know, I've gone away from the paternalistic type of medicine, which is the doctor sitting on his throne and telling you, do this and see you back in 1 year. This is a partnership. Find yourself a medical provider who's going to be your partner to see in where you are now and where can I get you with the right tools.
Wow. Amazing stuff. Rudy, thank you so much for just departing all this information onto us today. You know, I think an important message or takeaway from this episode, go for your checkups, right? Ask questions, get engaged in your own health, and stay active. Be proactive in your health, and the mental health and all other aspects of your life will start to come together, and you'll see that improvement. We have testimonies right here amongst ourselves. Talk to each other as men. Go do things together and support each other.
Completely.
And that way there'll be less of the competitiveness amongst each other and between women, you know, and be role models for your kids. Because that's the only way we'll change the world and the generations to come, by being the role models and being who we want the world to be. So men, there's lots of hope. You know, stay tuned for more episodes from Behind the Scrubs covering men's health awareness for this month of November. I'd like to thank Rudy for coming on today and sponsoring this episode. A New You is our sponsor. It's his wellness clinic, deals with men's health, hormone replacement, and lots of other issues related to health. And we'll happy to see you for the next episode, right? You want to come back?
What? Of course, man. So I'm going to plug in a couple of more. I also have another clinic where I do online consultation. It's called Medical Health Institute. That's the website, the Instagram.
We'll drop all the links at the bottom of this episode.
And my personal one is Dr. Rudy Best Life. Because people will ask me, they're like, okay, you You studied internal medicine. You talk about testosterone. You talk about GLP-1, weight loss. You talk about mental health. What do you do? Choose one thing. I'm like, my specialty is to bring you your best life. And I'll use any of those tools I need to. I'll become an expert at all of those tools, because at the end of the day, what do we want? Self-actualization. Your best life.
I love it. Stay tuned for more on men's health awareness. It's another episode of Behind the Scrubs podcast, and I'm your host, Dr. Andre Coombs. Follow us on Instagram, friends_of_medicine, www.friendsofmed.com. Shoot us an email, info@friendsofmed.com, and we'll leave all the links in the bottom, all the studies that we mentioned. And we can also reach out to Dr. Eberween to
Dr. Rudy.
Yeah, Dr. Rudy, for any questions that you may have, if you want to book a consultation or just, meet an outstanding physician that has done a lot for men in our community. So thank you again, Rudy, and I'll see you in the next one.
Looking forward to it.
Thank you.